Good evening. I'm Erica Sargent in the studio.
And I'm Brett Edwards in the newsroom. We have our team of reporters on Topic A tonight. Tara Melita, Jermont Terry, Dorothy Tucker. We begin with Charlie DeMar, live at the University of Chicago Medical Center, where workers are voicing serious safety concerns. Charlie.
Brett and Erica, the nurse who I spoke with tonight says he understands the risk. He takes every shift he comes to the hospital, but he expects to be notified by the hospital if he comes into contact with a patient who tests positive for COVID-19. But a recent internal memo that went out to staff has created confusion and serious concern. The hand-drawn signs planted in front of the University of Chicago emergency room make sure healthcare workers know they're appreciated as they fight COVID-19. The governor echoing that same message this afternoon.
Healthcare workers are being overworked, there's no doubt about it. They're doing heroic, amazing work every day.
But U of C pediatric intensive care nurse Brian Kelly,
we're not pleased at all.
Has some concerns over a recent memo sent to staff.
I just don't understand this memo. They really have a responsibility, I would think, to make sure that we know.
The memo reads, effective immediately, the hospital will not be contacting people who cared for or were exposed to COVID-19 patients.
I feel like it's telling me that it's my responsibility to find out if I've been exposed.
The email was authored by Dr. Emily Landon.
Things are already tough in Illinois hospitals, including mine.
The infectious diseases expert spoke last Friday as the governor announced a statewide stay-at-home order.
I'm being very measured.
But for this nurse of nearly 20 years, he wants the U of C, the hospital he works at, to tell him if he's come in contact with patients who've tested positive so he can take the safest precautions.
Perhaps there's some epidemiological science behind it. I cannot say. I really cannot understand it. It just seems like doublespeak to me. If we're not kept safe, we cannot keep the community safe.
A spokesperson for the hospital says that she was checking to get a little more clarity on what that internal memo meant, if the reporting process would be taken over by a different part of the hospital or what, but still have not gotten a clear explanation as to what that part of the memo meant. We are live from the University of Chicago emergency room. Charlie DeMar, CBS 2 News. Erica.
All right, Charlie, thank you.